Hey T, what's going on? Congrats. I hear you were getting close to graduation.
Thanks, Ben. Nothing much, still trying to get all of my hats figured out. It really is a totally different perspective practicing nursing versus being a medic. How's the fire department treating you?
Oh, it's great. I am getting some great experience and now I have a lot more interaction with nurses too. What do you think is the hardest part for you so far?
Actually, funny you should ask. I am currently working on a delegation project for school and I feel that delegation is probably going to be my downfall.
Why do you say that? You delegate all the time.
I know, but it is so much the same, as it is different. The hierarchy is also different. One important fact that I have recognized is that with both being a medic and a soon-to-be nurse, we are always the delegatee and the delegator. As a delegatee, I am working under medical control physicians, state protocols, policies and procedures. It is solely my responsibility as the highest level of pre-hospital provider to know the limitations and scope of basics, eyes, medic students, third riders and any other medical professional that may be providing care in the field. Not only is it my responsibility, it is my liability as well. Sometimes the pressure seems this big.
Well, at least you don't have to worry about that when you become a nurse.
But you are mistaken. I do. Same concept, different players. In the field, we assume a two-man crew and we work alongside other pre-hospital providers. In the field of nursing, I may have unlicensed assistive personnel such as techs, aides, and even LPN that are working under my direction and supervision. I also have to work alongside and collaboratively with other nurses.
T, I do not understand.
All right, Ben, let's look at our last code together. Remember the patient on Main Street?
Oh, yeah, I remember that guy. And of course, the rule of flights. 400-pound man, found down in the back bedroom of the 4th floor apartment. And no elevator.
Yes, him. Fire and PD were on scene and initiated CPR. When we showed up, I had to take control of the scene. I delegated firefighter EMT Jim to continue CPR and police officer Tom, a first responder, to assist with bagging the patient. I had you set up the life pack and place the defib pads and leads while I placed an EJ and an NIO. While obtaining IV placement, I was continuously aware of the skills delegated and was able to reassess the skills as I completed a rhythm check. The patient was in ventricular fibrillation and we immediately delivered 120 joules biphasic after the 2 minutes of CPR. I had asked firefighter Bob to set up the cot outside and prepare the backboard for extrication, all while continuing care. Because of our on-scene time restraints, I administered the vasopressin and amiodarone knowing that we needed the extra time to extricate. As you and the other firefighters were securing the patient to the board, I was prepping the tube kit and then intubated the patient.
That wasn't anything out of the ordinary. We are all trained in our roles and kind of knew what the other was going to do.
You are right, Ben, but then things got chaotic, remember? No one knew which end to pick up or which way we were going to carry him. So I assigned roles for that. As the 4 of you were carrying the patient down the stairs, we had to take breaks at every landing to resume CPR. I had to ensure that the end tidal CO2 was still capturing and that we didn't lose the tube.
Ah, T, do you remember what happened when we got outside? Ha ha. Ha ha.
Yes. Firefighter Bob never prepared the cot and it rolled down the hill. That was not funny, by the way. That one mistake cost us what? 4 minutes on scene. Let's fast forward to the transport. Now I was all alone trying to do CPR, bag the patient, administer meds, and of course, we get pulses back. So now in an 8-minute transport with only 4 minutes left, I had to complete a fluid bolus, get a 12 lead, call the hospital, hang dopamine and initiate hypothermia protocol.
Yeah, but come on T, you won't have to do that in nursing. I have never seen a nurse alone and they all know their roles as well.
Ben, you are correct, but with more team players there are more chances for errors. Communication is an important aspect of delegation. What did we witness once we got to the emergency room and transferred care to ER staff?
The doctor was at the head calling the shots, like a football coach.
Okay, how many people were in the room?
I don't know. It was packed. There was respiratory, radiology, the doctor, the physician assistant, 3 or maybe 4 nurses, and a couple techs.
Okay, can you remember who is doing which role?
No, it was crazy hectic.
Exactly my point. In this situation, the doctor was the coach and one of the nurses was orchestrating and observing while documenting who, what, when, where, how and why.
Well, have you spoken to other nurses in regards to their personal reflection on delegation?
I have. Berta, an emergency room nurse, stated that delegation is a great natural skill for some. But, for most it is a learned skill that can take a while to master. The best way to master delegation is by observance and recognizing that each delegatee has different strengths and learning how to best utilize them in line with the 5 rights of delegation. Sonia, a labor and delivery nurse, gave me some food for thought when she stated that not all delegation is fair and at some point I might run into a situation where favoritism and outside friendships can actually affect professional delegation. I also spoke with Rita, an emergency room nurse, visiting nurse, home care nurse and a medic. Her recollection of real-world nursing delegation is based off completing the most good for the client in an effective time span that utilizes all parties involved to their full potential and providing feedback in both directions from the delegator to the delegatee. Rita truly believes that no one role is more important than the other and that the best management is a team management approach.
I agree. Doe. Sounds like I need to go. Bye, T.
My final point is that in any job where there is a hierarchy of personnel there will always be delegation. Delegation is part of my responsibility for providing high-quality, competent care every day. Now, let's make sure we practice these NCLEX questions. We do not want Audrey to get mad at us.